Yeah, you can see day 11 shaved. That's something I could do, but finally my shaving cream arrived yesterday, so now I could shave, looking younger, hopefully. So, okay, today I wanted to share with you the Taiwan case. You have maybe heard about Taiwan. Taiwan is just 100 miles from China mainland, and how Taiwan managed the outbreak and how they could limit the number of total deaths to only two people. It's a 24 million inhabitants population, a very dense population. So it's really interesting to learn from Taiwan. And I would also like to use this to do a sort of a brainstorming to ask ourselves, our governments, how to prepare this, planning it right now, because that will not be the last pandemic we will face. This is just another one, and we will have more in a global community, in a global world. We need to be prepared and very, very well coordinated. Not like in this case, we're not coordinated, and I don't think that we're doing a good job right now. So let's start with our data analysis. As I said, after this analyze, we have a look at Taiwan. Let's start with our daily analysis of the data as we have it. You remember, just wanted to tell you that the COVID-19 is, the name is really SARS coronavirus 2. The SARS virus was a virus that was affecting Asia in 2004. It's called the severe acute respiratory syndrome, and it is a coronavirus. And this is a second coronavirus. So it's just a similar virus. So it's called clinically COVID-19. Okay, the data since yesterday, we see there's a sort of a data dip here. You can see, we have seen that before here. There's some dips always. So on the daily deaths, as I told you many times already, that these are not always consistently reported from the different countries. So you cannot 100% trust the daily data. So the important thing is that the trend is still intact. You will see that tomorrow. And if you go over to the daily new infected, you see that the curve is still exponentially growing. Yesterday we were over 30,000, 35,000, and the day before over 30,000 new infected. And while the United States is already over 13,000 daily new infected. Looking at our new analysis we introduced yesterday, what we did is to establish a line where all countries have the same level of new infected, around 200. So this is, and then we count the days to be able to compare how the different countries develop comparing to the other countries. So what can we observe? We have now, out of the 8 countries are in day 13 comparable. That means that we have these curves here. That's the line here, the day 13. So what we can see, obviously, I always put Korea because Korea on day 13 was already well below the average of all the other countries. And you can see that they're picking up. And the red one is the China curve here. So that is basically our baseline. We have to watch and compare with the locked down country in China. Korea, as you may recall, they do not have a lockdown. They just do this extensive testing. And so at day 13, which comparable, we are very close. So we have 4 countries, United States, Germany, Spain, close to China here in that spot. And United States and Spain, we can see it already will be taking off the next days. If you look into 14, 15, 16, we'll see how UK is coming in. Also, Italy, you will see they're getting over China in the next 3 days already. So does also Germany. So the daily deaths, it's different. We have 17 days since the first death was reported in these 8 countries. So we know at day 17 comparable. What can we see? Spain still at the head, more deaths, daily deaths in day 17 than any other country. The countries are all at 17, of course. Germany here is at 47. And France is also over China at day 7112. So does Italy. So you can see that very well in this graphical presentation that this is Spain, yellow, Italy, green, France, red, and that is China here, that all these three countries are over China already. Well, most importantly, where are we in our peak window? So again, yesterday looks like we have some positive information coming from Italy. As I told you, the first day of the peak window, we had the peak right now of the daily death. Sorry. We were at 793 on 21st of March. Yesterday we went down to 683 again. So we are in the peak window looks like really in the death. This is in the daily death where we expected the numbers to go still up. This is good news. And the daily new infected are really going down. Yeah, from 6,500 first day of the window now, we again around 5,200. So we are in the window. We have to still observe the next days what's going on, especially here on this side, because the daily death peak is expected later. So if it's earlier, much better for Italy, of course. Spain, well, Spain looks quite bad in terms of new infected. It's still going up. Just had one number here, 22nd, it looked like it would go down, but then it picked up quickly to 6,300, almost 7,500 yesterday, and 656 deaths still. So the daily deaths expected to keep growing, and we are now in the first day of the peak window for daily new cases. So hopefully we'll find here a similar pattern comparing to Italy, where, as you can see, we were at day 1 of the window in the peak. We'll have to confirm this over the next days, of course. Yeah, Taiwan, I will show you now a video about this. Taiwan is a country with almost 24 million inhabitants, only 100 kilometers from mainland China. And how they managed to stop a possibly disastrous COVID-19 break on its overpopulated island. So enjoy the video. It's really clear and shows how it works.
The US, we got a late start. We got a head start. Before people say ready, set, go, they were already prepared for it. So when people say go, they were running. They quickly went on the airplanes of people who were coming from Wuhan. Before they deplaned, they checked their symptoms. So they were very vigilant in detecting possible infections coming in. They activated the National Health Command Center that they had set up after SARS in 2004 that allows the government basically to have interagency coordination. And then they use big data, and they integrated the data set from the National Health Insurance Program with the data set from the Immigration and Customs database. So when a doctor sees a patient, it was said that this patient has been traveling to different countries because they got the immigration data. For example, if you have people coming from Wuhan, where the epicenter, they will ask more questions about if they had fever or cough, and they may order a COVID-19 test. So they integrated the data, they used it for disease detection. Health officials will call these travelers under quarantine 2 or 3 times a day to make sure their symptoms didn't get worse. And if they get worse, they will help them to get to the doctors. If they didn't, they continue to stay home, and they will bring them food. If they break quarantine, let's say they decided to go out, the government will go after them, and they will give them a big fine. So more recently, they started to pay people during quarantine. So you're getting paid to stay home, basically, if you're under quarantine. So that, then people wouldn't worry about food or housing. Government took control of making masks and distribute them. because they realize that this is a critical materials for fighting this epidemic. So really that they block a lot of people from coming to the hospitals if they have symptoms. And then if they have fever, they are triaged to another place, right, to be taken care of in another place. And so these kind of policies and procedures are ongoing in every single institution. And certainly in public buildings, when you walk in, there's a scanner, and it could tell if you have fever on the computer. Okay, this person has fever, you have to take the temperature, you can't go into the building. And so those are the things that they're automating. I mean, their schools are open, kids go to school, and they have their temperature taken, but they go to school. I think a lot of the public health preparedness is about having the right infrastructure that you could activate during a crisis. And I think we have just been relaxed for the last decade, and certainly in the last few years that there's not been enough attention at both the federal government and some states to really prepare us for this a quick response. The U.S., we got a late start, so there's a lot of work right now in every single hospital, every single health care institution in the country prepared for this. Right now, we should take this lesson very seriously because it's going to hit us hard. But hopefully, if everybody could do their part and stay home, the disease spread will get a lot slower, and then we could handle it. We will have a chance.
So, the question: which are the keys to Taiwan's success to avoid the COVID-19 outbreak? So, I wanted to summarize after watching the video. The key things. The early start, they started December 2019, didn't wait a day. They got on the planes coming from Wuhan, checking and asking people for symptoms. They activated the National Health Command Center. They used big data in analytics and integrated, that is very important, the data from Immigration Customs database with the National Health database, so they could really look at the data from an integrated perspective and not siloed data they could not combine. And the most important thing, they have built this National Health Command Center after the SARS 2004 and the first coronavirus, almost 16 years ago. So that brings us to the question, what has to change to combat future virus pandemics? I thought that these are the key aspects here. What is needed to avoid future virus pandemics? We need decentralized, standardized, global real-time data capture, so the data is uploaded directly from where the data is captured into a global database so we can have that data. We should set up, run, and maintain a centralized global database called Global Virus Outbreak Database, GVODB, we should also allow in that database to trace back the infected. So we need to have a tracing mechanism. How that would work, we have to find the technology to do this. There is technology to do it. We need the geolocalization of the infected, know how they move. We have to control them, maybe with the mobile app, so that we know that they're really in quarantine. You can control these people remotely, not physically. So we can really exactly know where people are. Then it has to be financed and operated by the World Health Organization, by a global organization that's properly financed and it can work. And we need obviously simple, global and continental outbreak protocols, early proactive coordination communication, which was what failed clearly in this crisis here. Yeah, that was it for today. Thank you very much. I just want to share quickly the last minute data. This is of this morning, 6:50, 470,000. And you see the curve is absolutely exponential. So this is just starting. And we continue with the vlog. And thank you very much. I wish you stay safe, stay at home, and please follow the authorities.
Noche de bohemia y de ilusión, yo no me doy a la razón, como te olvidas.